Hello, my name is Sarah, and I'm excited to present our research today titled Socioeconomic Determinants of Psoriasis, Individual and Neighborhood Level Correlates in a Pan-Canadian Cohort. This study was conducted under the supervision of Dr. Elena Puruk at McGill and funded by Psoriasis Canada and CIHR through the Summer Student Research Scholarship in Psoriatic Disease. So our objectives today, we know that psoriasis affects nearly 1 million Canadians, creating significant health and economic burdens. While socioeconomic factors influence many chronic diseases, the combined impact of individual and neighborhood level socioeconomic status on psoriasis risk has not yet been evaluated on a national scale. So we used data from CanPath, which is the Canadian Partnership for Tomorrow's Health database, to examine how personal socioeconomic status, like income, education, and employment, as well as community contexts like neighborhood instability or deprivation, relate to psoriasis prevalence across Canada. Our cohort included over 26,000 adults, 13,359 of them being psoriasis cases, matched with age and sex-matched controls. So psoriasis was based on a self-reported physician diagnosis, and we examined household income, education, employment, and marital status alongside census-linked neighborhood indices, including material deprivation, instability, dependence, and ethnic concentration. We used a multivariable logistic regression and adjusted for age, sex, ethnicity, smoking, alcohol use, family history, and comorbidities. In terms of our key findings, we found that employment was actually associated with a lower odds of psoriasis overall. Among non-white participants, being married was linked to a 23% lower likelihood of psoriasis, while among white participants, the disease was more frequent in the lowest income quintile, with decreasing odds across higher incomes. Those with a university education had slightly higher odds of psoriasis, which possibly reflects better healthcare access and diagnosis rather than an increased biological risk. At the neighborhood level, people living in areas with greater residential instability, which means that residents may move more frequently or rent homes, they had a higher odds of psoriasis. While in the non-white participants living in areas with a greater ethnic concentration, which may include more visible minorities or immigrant residents, was actually a protective factor for psoriasis. When we repeated this analysis in newly diagnosed psoriasis cases, the link between neighborhood instability and psoriasis was even stronger. So these findings really suggest that social cohesion and residential stability may really play key roles in psoriasis risk and detection beyond traditional biomedical factors. So in summary, psoriasis risk in Canada reflects both individual social conditions and community context. Employment and marriage really appear to be protective, while living in unstable neighborhoods can increase risk of developing psoriasis. These results really emphasize the need to integrate social determinants of health into future dermatologic research and targeted public health strategies, especially in diverse populations. Thank you very much for listening. This work represents one of the very first national investigations linking socioeconomic and environmental data to psoriasis in Canada. We gratefully acknowledge the CanPath database and CanU for data linkage support. Thank you for the team at McGill and the supervisor, Dr. Elena Puruk, as well as thank you to the scholarship, and please stay tuned for future publications. Thank you.